Lots of criticism tonight about how the Dallas hospital handled their Ebola patient. We're asking local hospitals how they're preparing.
And Salem Hospital really got a dry run yesterday with a patient who they first thought might have Ebola. Cor Harlan got to see firsthand how they dealt with it.
The Ebola scare patient came to Salem Hospital through a special entrance and into an isolation area. The hospital says that's a way to give patients the care that they need while minimizing the risk of spreading disease once it's here. I got an up-close look at what goes on before a potential Ebola patient even arrives at Salem Hospital. Staff nurse Andy Stipe put the gear on for us to show us how it's done, but Wednesday morning it was no drill. Andy volunteered to suit up and provide care for a person who came to the hospital with some Ebola-like symptoms.
From my perspective, this is what we're trained to do. We're in the emergency department. We take what comes.
As the day wore on, and with the hospital in constant contact with state health leaders and the Centers for Disease Control, it was determined the patient did not have Ebola. But the hospital tells me it was a good exercise, if nothing else, for how to treat, contain, and prevent a person with a potential infectious disease from infecting the rest of the community.
By design, that's how we use that room. So it's not the first time that room or that process or procedure has been used at Salem Health.
It worked out.
It worked beautifully.
Since there's no Ebola test available for hospitals, I found out frontline caregivers like Andy Stipe are trained in how specifically to put hospital gear on to keep themselves safe while caring for an infectious person. And if Andy stays safe and isolation procedures are followed like they were Wednesday, the hospital says whatever sickness comes their way, they'll be able to care for it without endangering the rest of the community. In the event this patient had actually had the Ebola virus, they would be transported at some point to Harborview Medical Center in Seattle. That is one of the facilities nationwide equipped to deal with Ebola patients. In Salem, Cor Harlan, KOIN 6 News.